Fighting is also continuing in the Gaza Strip, where the Israeli army says that it has struck 45 Hamas targets, including bases, rocket launchers, and weapons caches. A large-scale ground operation is also underway in northern Gaza. As more Israeli strikes hit Gaza, the Hamas-run health ministry says the death toll from the attacks has now risen above 42,000. Israel began its operations in Gaza a year ago in response to the October 7th attacks by Hamas, which is seen as a terrorist group by multiple countries. All right, I want to bring in now François De Keersmaeker. He is the director of Doctors of the World Germany. He joins us now from Munich. It's good to have you with us. And let me ask you about this figure, with the death toll in Gaza now exceeding 42,000. That's according to health authorities in Gaza. How is Doctors of the World adjusting its operations inside Gaza?
Yes, it's a very good question and not easy to answer because as we hear all the reports since already 1 year now, our operations are really organized on a daily basis because every day something new happens. We are forced to displace our staff. People are forced to change their locations and according to the movements orders from the Israeli army. So for us, it's quite difficult to have stable programs. Still, we have somehow managed to have 4 different mobile teams. They have to be mobile to be able to help in the different shelters organized for the displaced persons. We also provide help for 6 fixed primary health centers, and we provide support for 500 to 4,000 people a day. This is the amount of people affected, and only from the side of our small MDM organization.
Let me ask you about the situation in Lebanon. What specific emergency measures and long-term strategies are you implementing to assist the people there?
Again, here, the situation is moving every day. So our advantage is that we are working since 20 years in several parts of Lebanon. So also here, the only way at the moment is to deliver aid through mobile teams that are already on the ground. And so every day we have to adapt. We have to change our security rules also in order to be working as safe as possible, which is a real challenge in Gaza, especially, but also in Lebanon, as we are testimony that humanitarian law is not respected, and humanitarian workers are also at the very danger to practice their work, and many staffs of ours or from other organizations are also hit by the attacks. So it's a really, really big challenge for aid organizations there.
And how does this compare to your intervention in Gaza? And I'm wondering, how do you ensure the safety of your medical teams?
Yes, as I said, the safety of the medical teams, especially in Gaza, is very unstable, or there is no security. We have to coordinate every movement with the Israeli authorities, the Israeli army, who is giving authorization to move from here to there. And at the same time, this is not even giving the full security that our convoys will not be hit. And the same is happening now in South Lebanon, especially because there is still moving war scenario. We don't know which territories are occupied by whom. So for us, it's a permanent challenge to make sure that we can provide some limited help under almost unsafety circumstances.
Mr. De Keersmaeker, you know that a ceasefire is not on the horizon. what does that mean for your organization? I mean, what are your priority projects if you look into the future for the next 6 months?
Yes, even if the ceasefire is not on the horizon, that's the reality today. But since 1 year, we are permanently pleading for that, appealing, begging for that, because this is the only way to provide the necessary help. The circumstances in Gaza, already in November 23, we were horrified by the circumstances under which people had to live, the total collapse of the medical systems, people being treated on the ground, no medications to the basic medications to save lives. So this we are a testimony of that since more than 1 year. So we keep believing and appealing for a complete ceasefire, unconditional ceasefire, and opening the routes and the checkpoints for aid convoys. Otherwise, we will see an increase, permanent increase of death and suffering. And this is not anymore acceptable. This is inhuman.
Okay. François De Keersmaeker, Director of Doctors of the World, Germany. We appreciate your time and your insights tonight. Thank you.
Thanks, you're welcome.
And we're joined now by Carl Skau, who's the Deputy Executive Director and Chief Operating Officer of the UN World Food Programme. Welcome to DW, Mr. Skau. Great to have you on the show today. If we can focus on Gaza first, the humanitarian crisis, of course, has been intensifying. Could you bring us up to date on the current food situation in Gaza?
Well, the food security situation has really deteriorated over the past few weeks. We were able in June, July to stabilize somewhat the situation when it comes to access to basic food commodities, but that progress that was made has now been reversed. Most dramatic is, of course, the situation in the north. Since the past few days, we've not been able to access the north. It's basically circled off, and we're not able to operate in the north. In the south, we're still struggling with access, both getting enough food to the border, but also getting across and to our warehouses and to distribution points. So again, we are worried. We are facing a winter, and we are now seeing a backslide in terms of the progress that had been made.
And so the main obstacles that you're facing in delivering aid to Gaza is essentially that you can't get in?
Well, in the north, it's the operations are completely down because of the evacuation orders, and we're not able to access any access points, whether from the south or the entry points that we've used from the north. So since a few days back, our operations are down in the north. In the south, it's not enough. We're delivering on a daily basis maybe a third of what we used to about a month ago. And so, again, what is also happening is the commercial sector is tightening up. And so, you know, that combined, the humanitarian and the commercial coming down, the situation will deteriorate quite quickly. And this is happening just as communities begin to prepare for the winter that comes around the corner.
If we could turn to Lebanon, were you prepared for the large number of people who are now displaced in Lebanon?
We were quite well prepared. We have a very strong operation in Lebanon. We have been able to assist some 200,000 people already with hot meals, with ready-to-eat food packages. We're mainly focusing on the 200,000 people that are in the shelters, but of course trying to identify where there are needs also elsewhere. We have the capacity to scale up this assistance. We are ready to reach about 1 million people. But of course, down the road, a couple of weeks from now, it will be important that the ports remain open and the other supply routes remain open so that we can restock and continue our assistance.
Looking ahead, I mean, how many more people do you expect to be displaced if these attacks, this fighting doesn't end soon?
it's very difficult to predict. But as I said, we have readiness to assist about 1 million people. We are right now estimating that about 1 million people are on the move, or at least impacted by this escalation in fighting. I think the issue now is to be able to identify and to assist everyone in need. So far, the focus of our operation has been on those who have found rescue in the shelters, but we know that there are a lot of people who are also staying with family and friends, and of course, you know, with time, we will need to also assist those.
Mm-hmm. What about the people who have fled to Syria? The Lebanese government is saying that 400,000 people have fled to Syria. What are the conditions like there?
Well, there I must admit we were not as prepared, because we didn't really see this coming with the volumes that we're now seeing. And partly is because we have really had to scale down our assistance in Syria over the past couple of years from some 6 million people to now about 1 million people. And so the situation in Syria was already extremely fragile and extremely dire. And so the fact that now hundreds of thousands of people are seeking rescue in Syria, I think speaks to, you know, the fear and the desperation in Lebanon itself. We are working together with UNHCR, with UNICEF and other agencies to try to address the basic needs of those who are arriving, and we will have to see how we can scale up. But resources, when it comes to our response in Syria, will be an issue.
Your country director for Lebanon warned yesterday that Lebanon could be on the same, and I'm quoting here, the same spiral of doom that Gaza is on. To what extent are the situations in Gaza and Lebanon comparable right now?
Well, the people in Lebanon are really fearful that something similar will evolve. And there is that fear in society, understandably. That must, of course, be avoided at any cost. And the Secretary General of the United Nations has spoken to the importance of de-escalation and finding political solutions going forward. Our focus is really on addressing the food security needs and trying to reach those who are in dire need of assistance.
Carl Skau, Deputy Executive Director of the UN World Food Programme. Mr. Skau, thank you so much for your time today. It was great having you on the programme.
Thank you for having me.